World Health Organization. Key facts on increasing health problems. The health challenges. In health sector, India has made enormous strides over the past decades. The life expectancy has crossed 67 years. In fact, and under 5 mortality rates are declining, as is the rate of disease incidence. Many diseases such as polio, guinea, worm disease, yaws and tetanus have been eradicated. In spite of this progress, the communicable diseases is expected to continue to remain a major public health problem in the coming decades, posing a threat to both national and international health security. Besides, endemic diseases such as human immunodeficiency virus infection and acquired immune deficiency syndrome, that is HIV/AIDS, tuberculosis, malaria and neglected tropical diseases, the communicable disease outbreaks will continue to challenge public health, requiring high level of readiness in terms of early detection and rapid response. In this regard, vector-borne diseases such as dengue and acute encephalitis syndrome are of particular concern. Antimicrobial resistance is one of the biggest health challenges facing humanity that must be tackled with all seriousness. In addition, non-communicable diseases or NCDs are now the leading cause of death in the country, contributing to 60% of deaths. 4 diseases, namely heart disease, cancer, diabetes and chronic pulmonary diseases, contribute nearly 80% of all deaths due to NCDs, and they share 4 common risk factors, namely tobacco use, harmful use of alcohol, unhealthy diet and lack of physical activities. Cancer. Cancer, a non-communicable disease, has been ranked as the second or third main cause of death globally among persons who survive the first 5 years of life. Contrary to the general belief that cancer occurs mainly in the industrialized world, it is estimated that more than half of all cancer patients today are in developing countries. Cancer is the second leading cause of death globally and is responsible for an estimated 9.6 million deaths in 2018. Globally, about 1 in 6 deaths is due to cancer. Approximately 70% of deaths from cancer occur in low and middle income countries. Around 1/3 of deaths from cancer are due to the 5 leading behavioral and dietary risks: high body mass index, low fruit and vegetable intake, lack of physical activity, tobacco use and alcohol use. The most common cancers are lung, breast, colorectal, prostate, skin cancer and stomach. The most common causes of cancer deaths are cancers of lung, colorectal, stomach, liver, breast. Diabetes. Diabetes is on the rise, no longer a disease of predominantly rich nations. The prevalence of diabetes is steadily increasing everywhere, most markedly in the world's middle-income countries. When diabetes is uncontrolled, it has dire consequences for health and well-being. In addition, diabetes and its complications impact harshly on the finances of individuals and their families and the economies of nations. People with diabetes who depend on life-saving insulin pay the ultimate price when access to affordable insulin is lacking. Globally, an estimated 422 million adults were living with diabetes in 2014, compared to 108 million in 1980. The global prevalence age standardized of diabetes has nearly doubled since 1980, rising from 4.7% to 8.5% in the adult population. This reflects an increase in associated risk factors such as being overweight or obese. Over the past decade, diabetes prevalence has risen faster in low and middle income countries than in high income countries. Diabetes caused 1.5 million deaths in 2012. Higher than optimal blood glucose caused an additional 2.2 million deaths by increasing the risk of cardiovascular and other diseases. 43% of these 3.7 million deaths occur before the age of 70 years. The percentage of deaths attributable to high blood glucose or diabetes that occurs prior to age 70 is higher in low and middle income countries than in high income countries. Complications. Diabetes of all types can lead to complications in many parts of the body and can increase the overall risk of dying prematurely. Possible complications include heart attack, stroke, kidney failure, leg amputation, vision loss, and nerve damage. In pregnancy, poorly controlled diabetes increases the risk of fetal death and other complications. Cardiovascular diseases. According to World Health Report 2002, cardiovascular diseases, that is CVDs, will be the largest cause of death and disability by 2020 in India. In 2020, 2.6 million Indians are predicted to die due to coronary heart disease, which constitutes 54.1% of all CVD deaths. Nearly half of these deaths are likely to occur in young and middle-aged individuals, that is 30 to 69 years. Currently, Indians experience CVD deaths at least a decade earlier than their counterparts in countries with established market economies, that is EME. The Global Burden of Disease study estimates that 52% of CVD deaths occur before the age of 70 years in India as compared to 23% in EME, resulting in a profound adverse impact on its economy. The contributing factors for the growing burden of CVDs are increasing prevalence of cardiovascular risk factors, especially hypertension, dyslipidemia, diabetes, overweight or obesity, physical inactivity, and tobacco use. It is an area where major health gains can be made through the implementation of primary care interventions and basic public health measures targeting diet, lifestyles, and the environment. The epidemiological transition is in fact being fueled by the social and economic determinants of health and by some old and some by new risk factors such as globalization, unplanned and unregulated urbanization, changing lifestyles, environmental causes, that is climate change and air pollution, and increasing influence of media and advertising. Moreover, great disparities between the rich and poor and between those living in urban and rural areas in access to health services continue to exist in the society. For example, the poorest of the poor and the most marginalized sections of the society are not only at a great risk for communicable and NCDs, but are also least able to cope with the diseases resulting from these risk factors. If someone in the family gets sick, the family often gets trapped in poverty, partially due to the high cost of healthcare. The healthcare system is also overstretched. Thank you.